Now? Alright. So I'm going to go ahead and check the provider's orders to make sure to see if trach suctioning is ordered. It's going to be done every 2 hours or PRN as needed. I'm going to go ahead and come in the room. Knock, knock, knock. Hi, my name is Heather. I'm going to be your student nurse today. I'm going to go ahead and check my patient chart with my patient's armband. I'm going to go ahead and check for the name, date of birth, and the medical record number, which match. And do you have any allergies, Mr. Hicks?
No.
All right. So today I'm going to go ahead and suctioning your trach, get some of those secretions out of there to help you breathe easier. All right. So now I'm going to go ahead and raise my bed up. I want to go ahead and put my side railing down after I have my my table is clean, dry, waist high, and I already have it prepared. So now I want to go ahead and check my patient's vitals. I want to go ahead and auscultate his lung sounds in 6 to 8 places. I'm just going to go ahead and lift your gown up here. I want to go ahead, take a listen, go ahead and take a deep breath. All right. And good job. And also I want to go ahead and obtain a full set of vitals. And I want to go ahead and assess his skin as well. So now I'm going to go ahead and put my PPE on. And I'm going to go ahead and turn my suction on at this point. I want to make sure that my suction is at 100 to 120. And so now I want to go ahead, put my clean glove on. And I want to go ahead and occlude the end here of the suction to make sure that it is worked perfectly and that there is no issues with my tube. And put this in a convenient location for later. So now I want to go ahead and remove my glove, place in my trash, and wash my hands. Now I'm also going to go ahead and put my drape on my patient. And I want to go ahead and open my container. And I'm going to go ahead and put my normal saline in here. If this is already opened, which it is, I'm going to go ahead and lip my normal saline, and then I can pour it in here. And if I'm the first one to open it, I want to go ahead and put the date on here for the next person. And now I'm going to go ahead and put on my sterile gloves. All right. So now I'm going to go ahead and take the suction catheter out here. And now I'm going to go ahead and attach it. Now that I've attached it, this hand here is no longer sterile, and this one is because it's touching the tubing here. And I want to go ahead and test the suction to make sure that this is working properly. So now I want to go ahead and keep this here. I want to go ahead and remove that. And I got my resuscitation bag. I'm going to go ahead and give him 3 to 6 breaths at his normal rate of breathing and keep this handy. And I want to go ahead and let me think. And now I want to go ahead and I can suction. So I'm going to go ahead and insert this until I meet resistance. And I'm going to pull it back an inch, because once I hit resistance, that means I've hit the carina. And when I move it back, I note that it is at 15. So now that I've went ahead and suction, I'm going to pull it back and I'm going to twist it while removing it. And I keep my hand on this to make sure that when it comes out, it does not hit my patient in the face. And then I'm going to go ahead in the tubing here. I'm going to note the coca, the color, the odor, the amount, and the consistency. For the consistency, I'm going to make sure that it is thick, thin, or tenacious, and that the amount is either scant, moderate, or copious. Now I'm going to go ahead and clear the tube with normal saline twice. And I'm going to allow my patient at least 30 seconds to 1 minute in between suction attempts. And I'm going to go ahead and encourage him to deep breathe and cough to loosen the secretions in his lungs, to make sure that we're getting the best oxygen. I'm going to go ahead, suction one more time, 15, and back out while twisting it. And I noted it again. So now, and also in between, I am giving my patient a couple of deep breaths in here with my resuscitation bag. And my patient is breathing much better. Now I want to go ahead and remove his drape here. I want to go ahead and remove my gloves, and I have this wrapped in the glove because this has all my patient's secretions on it, and in the garbage it goes. So now I want to go ahead and do another respiratory assessment on my patient. I want to listen to his lung sounds in 6 to 8 places, anteriorly and posteriorly. I want to go ahead and get a full set of vitals, and with his oxygen saturation, I noticed that it has came up, so to make sure that it worked. If it hadn't come up, I want to go ahead and call respiratory stat. So now I'm going to go ahead and lower the bed, make sure that it's locked, his call bell isn't within reach, and now I'm going to document. I'm going to go ahead and document that I did a pre and post respiratory assessment. I'm going to go ahead that I suctioned at a 14 French suction catheter. I did the depth that I reached when I suctioned, and the coca, the color, the odor, consistency, and the amount, and how well my patient tolerated it, which he tolerated so well that he is sleeping through the whole thing.